You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. Get a fixed set of teeth in as little as just a few appointments. And with us, we have an expert on the topic. We've had him on the program before, Dr. Steve Brown. Dr. Brown, welcome to the program.
Hi, Randy. Great to be here again.
Now, for people that don't know you, and I know you brought a lot of photos, tell us a little bit about your practice. Who's the typical patient, and what are the different procedures that you do?
Well, Randy, we don't really have a typical patient. We have people that are young, that are old, but what we do see a lot of is people with big problems. People that think that they have the worst teeth in the world. They come in and tell me this all the time. Hey, have you ever seen a mouth this bad? So sometimes we do complete rebuilds of their mouth, and then sometimes we have somebody that has one tooth, one bad tooth. We do removable solutions for them. We do fixed solutions for them. But the main thing is we focus on small diameter implants and restoring those implants with either fixed teeth that don't come out or removable teeth that come out.
So now we talked in the green room. I mean, your whole practice, like you say, I don't do a lot of general dentistry. I mean, you do these small diameter mini implants. I mean, that's all you do.
That's exactly right. That's exactly right. I'd say about 95%, 98% of what I do is implants and restorative of those implants. And we focus on the small diameter implants because essentially what that is an implant by definition that's between 3.25 millimeters and about 2.9 millimeters. You get a little bit smaller than that, they may call a mini. But what I do most of is that small diameter range. And the reason I do that is because of what people present me. I mean, my philosophy is not to make the bone fit the implant, but to make the implant fit the bone.
Now, we said at the top of the show, no more dentures. You believe that?
Oh, absolutely. I think the day is coming when there won't be people wearing dentures without implants. I mean, why do we want to have, in this day and time, people with teeth that flop all over their mouth or come out of their mouth, that they can't eat with, they can't be comfortable with? So obviously right now the standard of care is moving to implant-supported dentures. So if you have a denture, we might as well support that with implants so that it has stability.
So that's the future, you say. I mean, like, who knows how long it'll take. But dentures as we know it will probably be gone, and they'll all be secured instead of by glue or adhesive.
Absolutely.
By dental implants.
Absolutely.
Okay.
I mean, you know, if you're a denture wearer, do you want to have to put glue in and taste that glue? And then we've learned that some of those brands actually can cause health problems. Okay. So do you want that, or do you want something that actually
Do they not like that, by the way? Did they tell you?
Yeah, I've never had anybody come in and say, Doc, you know, I just love putting this glue in my mouth. Can you tell me how?
But are dentures really like a big problem? You know, we talked over there. I said, are there that many people wearing dentures?
You know, Randy, you don't really realize how many people have dentures because the ones that have dentures aren't going to tell you about it. They're the kind of people that are going to hide their smile. They're not going to smile, so you're not going to notice them as much. But yeah, there's one study that says there's about 60 million Americans that have dentures. So just in my area, there's got to be, I'm in an area of about 6 million people, there's got to be tens of thousands of people with dentures.
So over 10,000 people in your area that have what, like an upper or lower denture?
Yeah, exactly.
That is interesting.
Yeah.
So I'm surprised to hear that there's that many.
Yeah, and that's the thing. That's why I'm here, because it doesn't have to be that way. People don't have to struggle with those teeth that flop all over their mouth, or if they laugh, they may come out of their mouth, or their grandkids say, you know, why do your teeth move? Why are they coming up and down? It doesn't have to be that way. With just a few implants, they can come in my office, and in one day I can place the implants in, and we can stabilize those teeth so that they snap in and out.
So they get a full arch of teeth?
Yeah, I mean, what we initially do is we take their existing teeth, and typically what we do is we take their existing teeth, we place the implants in, we retrofit their existing teeth, so the day that they come in with their dentures, they leave with those teeth anchored to implants so they can snap them in and out, they can clean them easily, and then we begin to make them a new set of dentures. But they no longer have to deal with that denture that's flying out of their mouth, and they can't cough, they're afraid to smile, all those things. They don't have to do this anymore when they smile.
So I had you on the show about 3 or 4 years ago. What's changed? Anything?
Well, yeah, there's been huge changes. I mean, at the time, a few years ago, what I was doing was I was actually using a film to place these implants. So that's not very much information.
You mean an X-ray?
Yeah, an X-ray film, and it has inherent inaccuracies in it and distortions in it. But since that time, I've got a cone beam CT, which is, you know, the CT is a CAT scan. So what I'm able to do is I'm able to see the exact dimensions of the bone. And essentially what it does is if you had a loaf of bread in front of you, you could slice that bread and cut it in half, and you could see the exact dimensions of the bone. So it's not a film based.
So to the patient, what does that mean?
Well, what that means to the patient is it's a lot less invasive. I don't have to dig around in the mouth to try to find out where I want to put the implant. I can be much more precise, which means I can have less trauma.
Less pain.
Less trauma usually means less pain. Exactly.
Now you say that because it sounds very painful, by the way, and you say pain is not something they complain about.
You know, I don't hear that very often. I rarely hear that. And the reason why is the techniques that we use. I mean, rarely do I make a flap, like an incision in the gums, and do all that, lay the gums open, and dig around and look at the bone. I don't do that. I rarely do that.
So the pain is really the gums, right? So the bone doesn't really have the feeling.
Exactly. The bone doesn't have very many nerves in it. I mean, there's one main nerve that runs through the lower mandible that you want to miss, and that's what that cone beam helps me do too. I make sure that I don't hit anything I don't want to hit. But most of the discomfort comes from the tissue, and the more you tug on the gums and cut the gums and pull on the gums and move, that doesn't feel good. But what I can do is I can make a tiny little pinhole through the gums and a pilot hole into the bone, which basically is just a guide for where I place the implant. And so when I make a tiny pinhole, a lot of times it's so small that if you were to look immediately after I do it, you couldn't see it. It's that small. The gum just comes back together. You don't even see it. So it's minimally traumatic. And like I said, usually if there's not much trauma, there's not much discomfort. Another thing that's changed is that it's mainstream. You know, at one point we were actually having to debate whether or not these things worked. And
that's right.
Helpful.
I was asking you questions like that.
Yeah, you were asking those kind of questions. But it's mainstream. There's been a lot of scientific studies. The evidence is all in. It's not even a debate anymore.
So it works now?
Oh, it worked then. There's just no debate. There's no.
Good,
and also in that time, I've been able to help hundreds of people. I've been able to place implants in hundreds of people and help them secure their dentures so they don't learn to have floppy dentures, and give them fixed restorations too. There's people that want fixed restorations, and we place the implants.
When you say fixed restorations, meaning?
Fixed teeth.
Fixed set a full arch of teeth?
Yeah, a full arch of teeth, maybe a full arch of upper, a full arch of lower, or full arch of both. When the advantage of that is we basically can cement those in the mouth, and then they don't move, and they're very small, shaped like teeth. It's the closest
What could they
thing.
eat, by the way? How strong are they?
They're very strong. And I have people come in and tell me, you know, for the first time in years, they can eat a salad, they can eat a steak, they essentially can eat nuts.
So they tell you they're eating stories?
Yeah, they do. They do. We talk about eating stories, and occasionally we talk about restaurants, and I tell them good ones, and they tell me good ones. So it's fun.
Now, you know, and people need to know it's a real interview, and I'm trying not to side with you, okay? But let's talk a little bit about your background and experience, because I said you're an expert on the topic. You've placed about 10,000 of these implants.
That's right.
That we're talking about. You, I guess you co-founded, and you're the president of the Academy of Small Diameter Implants.
Yeah, the American Academy of Small Diameter
Implants. What do you guys
Implants.
talk about at these meetings?
Well, I mean, what we do is we advance the art and science of small diameter implants. We continually work on new innovations to further the field, to do research, to publish articles, and figure out more and more ways that we can predictably help people. And you know, and one of the huge benefits about these small diameter implants is people come in and they've heard some sort of a presentation from someone else that's going to cost $35,000 or $45,000. I've heard people come in and say, hey, they were told their case.
So like traditional implants.
Yeah, traditional implants. They've come to me. I've had people come to me and say they have a $75,000 estimate on a case. In some cases, we're about 80% less to get an arch of teeth. Usually, we're about 50% less.
I mean, so you're not anti-traditional implants? I mean, because they work. They're proven, you say.
Yeah, I do both. I place conventional implants and small diameter implants, but not everybody can afford $40,000, and not everybody wants to go through a process of long, extensive bone grafting procedures that are uncomfortable, and of course, they may not work either. So I can do a wide range of things, and by making it affordable, there's more people that can do it, and it can change their lives.
But if it's as good as you say it is, and if there's tens of thousands of people within, I guess, an hour of you or in your neighborhood or wherever you said, that are wearing dentures, why aren't they all doing it? What's your take on that?
Well, I mean, let's start from the top. The denture patients don't go to the dentist anymore.
Good point.
So they're not going to hear about any. They're not even going to know about their options. And the other one is fear. Fear of pain, fear of expense, fear that they're going to lose their teeth. And a lot of them have already been through going to a dentist to get a same teeth or tooth fixed over and over and over. The last thing on earth they want to do is go to a dentist. They would just love for the problem to go away. But there are solutions.
All right.
Well, I mean, think about it. If you've lost all your teeth, these denture wearers have already had a long trail of tears to get to where they are. You know, they went for years and years repairing their teeth over and over and over. Maybe they fought gum disease and had numerous gum surgeries over and over. They went through pain and discomfort and bleeding gums, mobile teeth, embarrassing smile. The last thing they want to do is go see a dentist again.
Okay, that's a good point.
Yeah, I don't blame them.
So getting them to know about this is a challenge. Now, you've been on TV for quite some time with me. Do you have people that felt that way? Like they come in, they don't even believe it?
Oh yeah.
I mean, do they?
Yeah, I mean, there are people that do. They just think
like it's too good to be true.
It's too good to be true, and I mean, I think that's what happens to us as people. Sometimes we get in a rut, and we kind of accept this life that we didn't really hope for ourselves. And what I'm here to say is that you don't have to live in that rut. You may have spent 5 or 10 or 15 years experiencing things of embarrassment, not even feeling confident or self-confident, not eating what you want to eat, not eating healthy foods. But I'm here to say that there are options. And many times in one appointment, they come in my office, they walk in with these loose teeth that are flying all over the place, that are old and worn out, and I can place implants and I can retrofit those teeth. In one appointment, they leave with those teeth anchored to implants that snap in and out, and then we make them a new set of teeth.
So they're never without teeth?
They're never without teeth.
But what if you have bad gums, though? Not a good candidate?
Well, absolutely
implants?
not, because the problem with bad gums is you have infected teeth. I mean, that tooth is basically a cesspool for bacteria, which causes inflammation and swelling and bleeding and pain and mobility, can affect your systemic health. So the magic is the body heals. If you get rid of that source of infection, that cesspool of infection, you get rid of those teeth, the gums heal. You don't have bleeding, you don't have infection, you don't have discomfort anymore. And then we can use a healthy gum and place implants.
So people that have been told your teeth have to go, okay, so they have a decision to make: dentures, or secure, a fixed denture with the small diameter implants. You think some of them are self-diagnosing and thinking, I'm just too much of a mess to qualify?
Oh yeah, I hear that all the time.
Really?
I hear that all the time. They've heard from someone that they don't have enough bone without doing very extensive bone graft procedures, and they're not interested in those bone graft procedures, or they've heard or told themselves they're too old, and I've had people in their 90s get these implants.
90-year-old?
Over 90 years old.
Why would a 90-year-old want to do this?
Well, because they want to eat. They want to enjoy eating, and one of the most enjoyable parts of life. Every festival we have centers around eating. Every time we celebrate birthdays, anniversaries.
So
Christmas.
on that 94-year-old, did she complain about pain that you remember?
Well, actually, it's pretty funny because she surprised me. She came in and we placed the implants. We retrofitted her existing teeth, just like we typically do.
That means use her denture.
We took her existing, she walked in with old dentures, and we placed the implants, and we made her existing old denture fit the implants.
Snapped on.
Snap on, snap off. And as I usually do, I told my assistant, I said, okay, why don't you go tell her driver, that she's ready to go. And she looked up at me and said, I don't have a driver, I drove myself. So she's in her mid-90s. She comes in, she gets these implants, we restore her mouth and retrofit her teeth, and she drives herself home.
Is that right?
Yeah, it's pretty amazing.
Good.
I was impressed.
Now, the next day, are they just lightly sore? Are you giving them medication?
Yeah, we typically, give medication. We give antibiotics. We give pain medication. We don't want people to be in discomfort.
Are there any people that don't do it? That just take maybe
there's plenty of people that tell me, I don't like pain medication. I don't even take it. I never took anything. And then a lot of people take, just over-the-counter Tylenol, Motrin, things like that. So we hear that all the time. And what's really interesting about these small diameter implants is that when we place them, the next day when I look at them, they look like they've been there for years, because I'm not making big incisions. We're not traumatizing the tissue. So you look at the tissue and it's like, wow, this is happy. It looks like it's been here forever, and it's only been there less than 24 hours.
Okay, good. So back to the not enough bone, and I asked you about that, the older woman, because even my own mother, at one point, she said, my medical doctor said, and at 72, she's older now, at 72, she said, he said, I'm too old. They'll fall out.
Oh, that's a tragedy, because I don't know how many years she went believing that she...
But is that common, though?
Oh, it's very common.
Where they think they're just too old.
Oh,
but if somebody's been in dentures, though, and 75 is young today, but if they've been in dentures since 35 years old, and they're 75 now, do they still are they still candidates, or is that too far gone?
No, absolutely not. They're too far. They're not too far gone. And what we can do is we use my cone beam CT, and we take an image, and I can look at the exact dimensions of the bone, and I can tell them within just a few minutes. Okay, we can place small diameter implants, and then we can restore them immediately. Maybe if you have a marginal amount of bone, then we might want to put a bar on there so that we tie those small diameter implants together so that they work like a team. They're not individuals anymore. So even if you have compromised bone, very compromised bone, there's many times when we can place those implants. We may have to put a bar on them and stabilize them, but you can still get some help.
Now, anticipating this interview, I've had other dentists tell me, Randy, because I said he's doing fixed sets of teeth with the small diameter or mini implants, that he could do a fixed set of teeth. They said, I don't know about that.
No, that's absolutely not true. They're just
But
not
they
informed.
could say that, though.
Well, they can say that, but they're just not informed. I've been doing them for nearly 10 years myself, and the scientific studies are out. There's one that's been out maybe recently, about 4 months. It's about a 9-year study, and it demonstrates that the success rate is about equivalent to a conventional implant. So they've had long-term studies. We've had long-term success, and to say anything otherwise is just out of a lack of knowledge. One of the world's leading research dentists, Gordon Christensen, was at our Academy meeting just last year, and he stated that that is one of the most profound innovations in dental history, and that there's about 70% of the patients, if you don't do small diameter implants, you're missing out, or 70% of the patients that need them aren't getting them. So we can't have that thinking anymore, because there's people that needlessly suffer because they're listening to that kind of information.
So every week, would you say that you're giving people a fixed set of teeth? I mean, people that walk in with dentures, and you're giving them a fixed set of teeth.
That's right. This is what I do. I do it all the time. So I either do removable or fixed, and sometimes I'll do full arch fixed. I do a lot of that. I do more full arched removable just because it's less expensive. But I do a lot of single and multiple unit fixed. I do it all the time.
But there's a cosmetic component to this too, and you were showing me some of your photos, and I'll let you show them. But it was like you were showing me baby pictures. You're very proud of these photos.
Right. I mean, we've talked about the implant, and all the implant is a post that you can do something with. And what people really want is teeth. They don't care about the implants. And so, yeah, we really work hard at trying to give people the smile that they'd like, a smile that they can be proud of. We've studied it, and with each person, we customize that smile as much as we can, and we get their input.
How important is this smile?
Well,
I mean, you're a dentist. You probably think, what? It's the most important thing? Or?
Oh, well, I mean, it's not just me. I mean, yeah, certainly I think it's important. I wouldn't be making my life out of trying to improve smiles. But it's not just me. I mean, there's magazine after magazine, even muscle and fitness magazines have studies that say, hey, what is a mate feels the most important thing about their spouse? And usually within the top 3 is the smile.
That's a good point.
And of course, the smile is one of the first things we notice. I mean, it has a tremendous impact on our self-image and the way that we interact with people. I mean, a lot of people don't speak. They don't smile. They avoid social interaction because they're embarrassed about their smile. A lot of people that never smile are thought to be arrogant or mean. They're not at all.
Do you have patients that come in and you could tell they look mean, or you don't even know how to read them? Then you give them their teeth, a beautiful smile, and they come in acting differently on follow-ups?
Oh, yeah. Oh, we see that all the time. And then some of them have told us how it's changed their lives. We had a gentleman recently that he had missing teeth, he had decay, he had gum disease, and he was very embarrassed about his smile, and that really affected his self-confidence and his psyche. And you know, he wasn't dating as much as he'd like, and some of that was because a lot of it's because of self-confidence. Well, we took out those bad teeth. I mean, that was obviously the choice for him, and we put in implants, and we gave him immediate removable dentures. And he's called us and says, I'm dating all the time now. I'm going on dates all the time. And so it's had what we did made him look good. It made him eat better. We got rid of the infection, helped his breath. His breath didn't stink anymore. And what I think it really did is give him confidence. It gave him that ability to go out there and be himself and express himself, as the song says.
Now, you brought some photos that you're very proud of. Okay, and I always say I could spot dentures walking down the street, or fake teeth, but you say they're natural.
Well, I mean, we work hard to make them look natural.
Okay.
It's something that we really work with our patients on. Now, take a look at that smile. for instance, if you look at that smile, it looks very, very natural because it's not perfectly symmetrical. You can notice how the lower lip follows the edges of the teeth, how the middle teeth are the stars of the show, and you can notice how there's a little bit of asymmetry in the other teeth that are adjacent to it. They're not perfectly symmetrical, they're not perfectly arranged, how the colors vary slightly.
So I'm looking at mini implants or small diameter implants, and that's like a denture.
Well, in this particular case, it's better than denture in that this is fixed. This is a bridge. These are small diameter implants.
So it's a fixed set of teeth.
It's a fixed set of teeth. It doesn't come out. We cemented it in the mouth.
How old
it doesn't
is this
come
person?
out. She's about 47.
Interesting. And she would have been in dentures, or she was in dentures?
She would have been in dentures. Her teeth were always hurting. Her gums were always hurting. She was in a chronic pain situation. And she said, I've got to do something. I've got to change this.
That is way too young to be wearing dentures.
Well, no one should be wearing dentures.
Okay.
I mean, absolutely no one. We should have people anchoring their teeth to implants, whether they have removable teeth or fixed teeth. Well, and one other thing I want you to notice is in that case, we were very, very careful to support her lip. She was really concerned, the upper lip, she was really concerned about it. And she said she was so happy the way we supported her lip that she's not ever doing any of the lip augmentation anymore.
Okay, so without teeth there, obviously, or a denture might drop the lip.
Right. Well,
this builds out the mouth.
We were able to, because we're building the smile as we want to design it, we have a little bit more license. We're not stuck in mud like you are with existing teeth. So we're able to move those teeth out just slightly and move those gums out just slightly to support her lip. Now take a look at this one. This lady came in and she had bleeding gums, she had sore teeth, she had broken teeth.
That's a nice smile, by the way.
Well, thank you. So for her, she has an upper fixed set of teeth. They don't come out. We cement them in. She doesn't take them out. She cleans them just like their natural teeth. They act just like natural teeth. And we've made those out of zirconium, full contour zirconium, which is the hardest material we can.
So that's not what dentures are made out of?
No,
like
a denture is made of acrylic. Some people will give a fixed set of teeth, and what they'll do is instead of giving zirconium, which it doesn't absorb water and doesn't absorb bacteria, they'll use acrylic. And so they'll make what's called a hybrid, and they'll screw an acrylic denture with a metal substructure to the mouth. And yes, it's fixed. That's true, it's fixed, but it absorbs bacteria, it absorbs water, and if you ever take a denture out of the mouth and drill on it, it's going to stink because it's full of bacteria. Whereas this material does not absorb anything.
Is it stronger?
It's much stronger. It's much stronger. It's the strongest
those
thing.
Look like real teeth, I have to admit. You know, I told you, you know, I think I could spot. So she's got to be thrilled.
She's very thrilled. In fact, in this case, we did a lower denture that's anchored to the implant. So it comes in and out. The lower teeth come in and out. In her case, the upper teeth don't. And she loves the upper one so much that she's going to do the same thing on the lower. She's going to go fixed.
Okay. All right. Now what's the next one here?
This is another case. Here's a woman that comes in and she has pain in her teeth, pain in her gums, and we couldn't keep those teeth. We had to get rid of those teeth. So with her, she had infected gums. We removed those teeth. The gums got healthy. She doesn't have any pain in her gums anymore for the first time in years. Okay. And we were able to give her a beautiful, look at that smile, we were able to give her a beautiful smile.
Now, did this snap in and snap out, or this is...
No, this is fixed. This is the closest thing we can get to natural teeth. She eats whatever she wants, she chews whatever she wants, and she brushes them and cleans them just like natural teeth.
What is that process? And we literally are out of time, but so somebody goes in, denture wearers watching this, they're still skeptical, they go in, and what's their first question, by the way, when you meet these people?
Well, they ask me, the first thing they say is, have you ever seen anybody with a mouth as bad as mine? And of course I have. They all think they're the worst case, but we see, what I do every day is help people that have big problems, and that's one of the most enjoyable things.
But for the denture wearer, so they come in, what do they want to know? And how do you decide that final outcome and what they're going to look like?
Well, the first thing they want to know is this going to hurt? Is it possible to help them? A lot of them don't think they can be helped. And so the very first thing we do is we listen to what their goals are and their dreams and their hopes are. And then we basically go and take a cone beam CT. Then we give them their options, let them know they can have fixed or removable or whatever. Maybe they need a bar. And then we schedule them, we place the implants, and we retrofit their existing teeth. Then they go home with their old teeth, fitting those implants, and then we bring them back and we begin the process of making their new teeth, whether they're fixed or removable. And in that process, we'll actually build them a prototype.
Do you show them pictures?
Well,
well,
what we actually do is we build them a prototype and we put it in their mouth, which is a lot better than pictures.
And they look in the mirror.
And they look in the mirror and they can see what they're going to look like before they get them. So it's much better than pictures. They actually see it in their mouth.
What do they normally say?
Well, they come in, we place it in their mouth, and they look at it. And a lot of times they look at it and go, this is great, I love it. But I'll see something that I think we can change and improve it, and I'll ask them if they'd like me to do that. And if they say yeah, then we go ahead and move those teeth just a little bit. We improve it a little bit more to make it look natural, make it look a little bit asymmetrical. And then once they love it and I love it, once both of us love it, then we go ahead and go forward and we finalize it. And after we finalize it, that next appointment, they get it. They get to go home with it.
Okay, good. Now you have your own lab right there.
Exactly.
So you're making the teeth there in your
That's right.
in your office.
Exactly. We have our own lab. We have a full service lab. We can do metal work, we can do denture work, and we can do zirconium work, which is porcelain work. We have a milling machine, and so we can do all phases of it.
Okay, so it's affordable now, and this is not to be confused with traditional dental implants. This is small diameter mini implants. You say they work, you could give people either snap in, snap out, or a fixed set of teeth. Is that right?
That's exactly right.
Okay.
In fact,
no more dentures, you say?
Nobody should have dentures, and one of the reasons we can make it so affordable is because we have all this in-house. It helps us to cut down the cost.
So about 75% less than traditional dental implant for upper and lower fixed set of teeth. Is that true? 60% less? Half off?
Yeah, half off typically, or,
Okay.
or more, depending on who they've seen. But very typical if they're going to be doing fixed. And a lot of times with the fixed that they come in, well, they're not even comparing apples to apples. Because a lot of times when they're getting that fixed price, they're getting a screwed-in denture. We're not giving them a denture, an acrylic that's going to wear out. We're giving them the hardest material that they make, zirconium.
Interesting.
It's going to last
Okay.
much longer. It's going to look better. It's not going to be penetrable by bacteria, so it's going to smell better.
All right, okay, so final message, somebody watching this, denture wearer, they're still afraid, right?
Right.
Afraid of the dentist.
Right.
Think they're too old. What do you say to them?
Well,
Final message.
No one's too old. No one's too old. We've done these cases in their 90s. They don't need to be afraid. We're going to give them medication that'll help them relax, make them comfortable. It's a minimally invasive procedure. If they would like, they can have. We have an anesthesiologist that'll come to our office, and he'll just sedate them so that while I'm working, he's focusing on the sedation. He doesn't leave the room, doesn't have an assistant, and I'm focusing on placing implants and restoring their mouth. So whatever their fears are, we'd like to talk to them about how we can work through those and listen to what their goals and their dreams are and see if we can help them to accomplish them. Because they don't need to live with dentures anymore.
Okay,
and they don't
good.
need to wait
Good.
years and years and years and waste the time of their life that they've already spent living in a way.
You say just about everybody says I should have done this years ago.
Oh yeah, we hear it all the time. I wish this is, and I've heard many times, this is the best thing I've ever done. I've heard people say this is the best money I've ever spent. That's a profound statement.
Okay. Okay. I want to thank you for coming to the show.
Thank you.
Great info.
Thank you.
Great info. Always a pleasure to have you on the show. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview online, visit our website, and you could put in mini implants, or you could put Dr. Steve Brown. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.